Those of us here in Southwest Missouri probably remember last August when Christopher Key of the infamous Vaccine Police website made headlines in a local Walmart for saying that the people who administered the COVID vaccines should be executed under the Nuremberg codes, comparing the vaccines to biological weapons. Well, Key has now returned to the spotlight for his enthusiastic and horrific recommendation of how to bring an end to the pandemic. Drink your own urine.
Ugh.
This appears to be connected to a larger movement touting the benefits of drinking urine, demonstrated by a 37,000-member Facebook group called Reimagining. That group recently featured posts from a member who adds urine to lemonade to make popsicles for her daughter and her daughter's friends, all without them knowing it. She doesn't seem to notice, and I can see the benefits already, the mother wrote. She also voiced her confidence that the friends' parents would also be grateful to be included after they saw the undeniable improvements in their children's cognitive abilities. So, on the off chance that these words find someone who needs to hear it, I now have to add another thing to the list of items that I never thought I would have to say. Please don't drink urine, yours or another's. As Healthline points out, urine is not sterile, contrary to popular myth. And while it probably isn't dangerous in a small amount, it frequently contains bacteria, toxins, and medications.
And it's urine.
Please do not drink it. And also, please, do not substitute drinking urine and act with no scientific or medical support for actual life-saving, medically sound precautions and practices like, for example, the COVID-19 vaccines. Like many people whose community work involved being in close contact with vulnerable populations, I can't adequately describe the relief, gratitude, and hope I felt when I received my first injection of a COVID-19 vaccine in February of 2021. In fact, not a day goes by that I don't feel grateful, and with good reason. Natalie Musumeci reported this week on a recent research letter in the JAMA Network Open that revealed that from the first 6 months of the vaccine's lives, from December 2020 through June 2021, these vaccinations prevented more than 14 million COVID cases and saved approximately 241,000 lives in the United States alone, cutting hospitalizations and deaths nearly in half. The vaccines have been both life-saving and life-changing. As a fully vaccinated and boosted person, I don't have to live with the stress I felt in life before the vaccines. And I can't imagine feeling and facing the Omicron variant without my vaccination. Tragically, though, I'm one of the lucky ones with this option. While the main obstacles to an adequate vaccination rate that we face here in the Ozarks have mainly been related to vaccine hesitancy and an endless supply of conspiracy theories, like drinking your own urine, many places in the world haven't had that luxury. Early in the vaccine's availability in February 2021, distribution under the Corbevax initiative began, as Joseph Stepanski reported, to coordinate simultaneous distribution to both wealthy and poor countries. After all, it was understood that, quote, an equitable vaccine rollout was essential to preventing mutations of dangerous variants that would prolong the pandemic and potentially evade vaccines. But what began as both that grave acknowledgement and compassionate aspiration has not turned out as we had hoped. For example, the World Health Organization had a goal that all nations would reach a 40% vaccination rate by the end of last year. In Africa, where vaccine inequity has been severely pronounced, only 5 nations were on track to reach that milestone, with most failing to reach even 20%. Compare this to high-income countries, most of whom have surpassed a 50% vaccination rate and are now happily focused on administering boosters. Yet these nations are also the ones that continue to stockpile doses. Just before we began learning about the Omicron variant last November, the COVID Gap report documented that while the world was approximately 650 million doses short of reaching that 40% goal by the end of the year, the world's wealthy nations were sitting on more than 834 million vaccine doses. Al Jazeera has also documented that only 5% of people in low-income countries were fully vaccinated against COVID-19. Of course, vaccine equity isn't as simple as this one statistic, but this one statistic is a powerful symbol and reminder of our world's failure to address the pandemic in just, equitable, compassionate, and wise ways. Even as high-income nations hoarded vaccine doses, the powerful hoarded vaccine profits. For example, by May 2021, at least 9 new billionaires were created on the strength of COVID vaccine sales, including the CEOs of Moderna and BioNTech. And by last November, and as documented by Oxfam, we knew that Pfizer, BioNTech, and Moderna were making combined profits of $65,000 every minute. And they've done this despite receiving over $8 billion in public funding. As Maza Seyum of the African Alliance and People's Vaccine Alliance Africa pointed out, it is obscene that just a few companies are making millions of dollars in profit every single hour, while just 2% at that time of people in low-income countries have been fully vaccinated against coronavirus. She went on to say Pfizer, BioNTech, and Moderna have used their monopolies to prioritize the most profitable contracts with the richest governments, leaving low-income countries out in the cold. I'm trying to walk a tightrope here, emphasizing both my gratitude for the amazing work that made the creation and distribution of COVID-19 vaccines possible, with my conviction that a public health crisis should not be made into an opportunity for profit, especially profit at these obscene levels. Hoarding billions of dollars at any time, but especially while hundreds of thousands of people die due to lack of vaccine and health care, is immoral. But if you prefer the voice of someone who believes, quote, it's misguided to lament that private companies are profiting in the current crisis, I can offer you the words of Brink Lindsay, who wrote last June about the fundamental mismatch between policy design of intellectual property protection and policy requirements of effective pandemic response. He concluded that what matters isn't the existence or size of the profits, but how they are earned. We have good reason to want drug makers to profit from vaccinating the world. The comparative price is minuscule, and the incentive effects are a vital safeguard of public health in the event of future crises. What we want to avoid at all costs is putting drug makers in the position where drug companies can profit from standing in the way of rapid global vaccination. This is why intellectual property rights need to be taken out of the equation. We failed in what Lindsay was warning against. Importantly, these aren't unusual convictions, and leaders from around the world have been pointing it out for months if we have been listening. In September 2021, for example, South Africa's President Cyril Ramaphosa extolled COVID-19 vaccines as, quote, the greatest defense humanity has against the ravages of this pandemic, even while he condemned the global community for its collective failure to sustain, in his words, the principles of solidarity and cooperation and securing equitable access to COVID-19 vaccines. It is an indictment on humanity, he said, that more than 82% of the world's vaccine doses have been required by wealthy countries, while less than 1% has gone to low-income countries. And Zimbabwe's President Emerson Mnangagwa emphasized that vaccine nationalism is self-defeating and contrary to the mantra that no one is safe until everyone is safe.
Amen.
These deadly and tragic, and can I add, preventable trends are part of the overall shape of our global response to the pandemic, which we've discussed many times, and that caused Oxfam to describe COVID-19 as the inequality virus. In short, oppressive systems have made the pandemic more catastrophic. Social and economic injustice and the disparities they create are deadly at any time. The pandemic has amplified their deadliness. The world as we know it has been shaped by an approach to economic and social development that has fueled terrible inequality, climate change, and now COVID vaccine inequity. Our society's leaders, or at least too many of our society's leaders, seem comfortable with the idea that, hey, it's okay to sacrifice the well-being of the many for the sake of the profits of the few. But what about those principles of solidarity and cooperation that President Ramaphosa mentioned? What might a society look like that was oriented around those kinds of values? Thankfully, other approaches have been offered to help us rethink how we relate to ourselves, each other, and to the earth itself. And we get glimpses of this other world all the time, if we will make the habit of looking and listening. One of the more beautiful sights to see right now comes to us from Texas, where the Texas Children's Hospital and Houston's Baylor College have developed an open source, patent-free, low-cost COVID-19 vaccine named Corbevax. Initial and limited clinical data about the vaccine has shown it to be at least 90% effective against SARS-CoV-2 virus and 80% or more effective against the Delta variant. India has authorized it for emergency use, and Biological E Limited, an Indian pharmaceutical company, has already produced 150 million doses for distribution, with the goal of producing 1 billion doses during this year. The Texas team is also consulting with the World Health Organization to explore how the vaccine can be shared around the world. And this should make our hearts light up. This is wonderful news. Despite being told that this kind of result is simply not possible without an extreme profit motive, the team who developed this vaccine, led by Dr. Maria Elena Bottazzi and Dr. Peter Hotez, are motivated by saving billions of lives. And they've done it without the benefit of $8 billion in public funding that Pfizer, BioNTech, and Moderna received. In fact, Corbevax's creation was funded on a relative shoestring, receiving about $7 million, largely through private investment. This small, almost minuscule budget is both a testament to the team's hard work and an obvious limitation. Because while the initial reports are promising, we don't yet have the open data necessary to truly know how effective Corbevax will be, especially against the Omicron variant. Clinical trials cost money. So this is both wonderful and a little bit of heartbreaking news. As Hotez said to the Washington Post, if we had even a fraction of the support that Moderna had, who knows? Maybe the world would be vaccinated right now. We wouldn't be having a discussion about Omicron. Yet this shadow should not dim our celebration of the hard work and generosity that made Corbevax possible. This is very good news. If it continues to be successful, Corbevax gives us an incredible tool in addressing vaccine inequity. And it also helps us shift the conversation around what kind of society we live in right now and what kind of society we could live in. Peter Maybarduke, director of Public Citizen, emphasized that the development of Corbevax challenges, quote, the false narrative that vaccine production and medical innovation thrive through secrecy and exclusivity. The hope is that initiatives like Corbevax can help us shift that norm, and not just for vaccine production. In order to achieve real justice and equity in the pandemic, we need to insist on things like better sick leave policies that protect essential workers instead of expose them, access to effective masks and other PPE, improved testing options from availability to transportation to their cost, safe housing for anyone who is unsheltered and to those who share shelters but need to isolate because of an exposure to COVID, universal health care, universal education, especially for current and future healthcare providers, and massive investment in our infrastructure, especially in the infrastructure of our healthcare systems. As Ed Young wrote, rather than trying to beat the coronas one booster at a time, the country needs to do what the country has always needed to do: build systems and enact policies that protect the health of entire communities, especially the most vulnerable ones. Individualism couldn't beat Delta, he wrote, and it won't beat Omicron or the rest of the Greek alphabet to come. Self-interest is self-defeating. And as long as its hosts, us humans, ignore that lesson, the virus will keep teaching it. Self-interest is self-defeating. Vaccine inequity is a potent reminder of this. But there's an even more important reminder in the story of Corbevax. Inequity is not inevitable. Dr. Bottazi, Dr. Hotez, and their team remind us that people can make a difference, even when they don't have access to the same power and resources that the current system enjoys. As Dr. Keith Martin, Executive Director of the Consortium of Universities for Global Health, told NPR, Corbevax is a game changer. It's going to enable countries around the world, particularly low-income countries, to be able to produce these vaccines and distribute them in a way that's going to be affordable, effective, and safe. This very well could be a turning point in our struggle against vaccine inequity. And hopefully, our combined responses to the pandemic can be part of something much, much more. Because a world where everything that every person needs to thrive and enjoy life is affordable, effective, and safe, that's within our reach. We have that technology right now. We have the resources right now. Having borne witness to the pandemic's terrible toll on human life and well-being, may we all resolve to work together in whatever ways we can until everyone is safe. Thank you.
Thank you for watching our videos. We are entirely dependent on the donations of our listeners and members. We hope that you find this content to be important enough to help us to keep offering these videos to the public at no charge by becoming a regular contributor. Please click on the donate button on our website at www.spfccc.org. Thank you for your support of progressive religious programming.